Hey, in today's segment sponsored by Total Health Chiropractic, when you spend your working days taking care of others, as a nurse, it can be difficult to face the fact that it's you that needs to be taken care of. Now, that's Mindy's story, and she found relief from her pain at the place many others have done the same, Total Health Chiropractic.
So Todd, when patients walk into our office, a lot of times we find that they are struggling with a condition called degenerative disc disease. And that's where these pads and spacers in the spine actually dry and start to thin down. And then when that happens, it can encroach on the nerve and cause a lot of pain. So with DRX9000 Therapy, very specifically, we can address that one individual segment that's a problem and just gently pull that bone above and below apart in a way that it actually draws moisture and nutrients back into the disc. And as they rehydrate, they start to thicken up. That creates space for the nerves. It also acts as a shock absorber so patients can go live an active life and not have to struggle with pain any longer. So when Mindy came in, we did an exam and got x-rays and she had an MRI. We did find that she was down in this range with a fairly severely degenerated disc in her lower back, and thought she was a great candidate for DRX therapy and took us up on the offer, and she's doing great ever since.
I'm a traveling hospice nurse at night on call, and I do a lot of traveling, hour-and-a-half drives, 2-hour drives. It was getting very difficult for me to take these long drives with the way that my back was at this time. I had some degenerative disc disease going on. I had 3 bulging discs. I had L5 that was almost completely gone. I could barely bend over. I could barely do activities. I would, paint a bedroom. And the next day I was sitting down and crying because I painted all day and I was in a lot of pain. And just kind of, Lord, what do we do from here? I had degenerative disc disease. I had my spine narrowing. I was getting shorter. A lot of things were getting very complicated. So I called Dr. Miller's office and made a consultation appointment and tried to stay very optimistic. And I got accepted into the program. And I completed the DRX9000 and currently in physical therapy. I don't feel pain like I used to. I'm able to paint a whole bedroom and get up the next day and be able to do it again or trim it out, whatever needs to be done. I can do my kitchen now without resting. So a lot of the activities I was doing a lot of resting the whole next day, I don't no longer have to do that anymore. It's been a really good thing for me. I've been in healthcare for 20 years. I've been an aide for 10 years, a nurse for about 10, 11, 12 years now. That takes a big toll on my body because as an aide, I lifted people. And this is kind of how my back got to where it was. And now I feel amazing. I love working with my families. I love working with the patients. I'm not really an office nurse. I'm a field nurse. So I was faced with the fact of having to come out of that field when I didn't know what I was going to do with my back. I am able to roll my people and do what I need to do without the pain and free from pain. I'm able to take these long drives that are 100, 130 miles one way without the pain and the anxiety from the pain coming, knowing it's coming. I'm able to fully functional do my job again without the worry of having to come out of the field or going into the office, or I'm able to do a lot of my activities that I was not able to do or had to take many frequent rest periods to do them. And when I look at my options and I weigh my options, when I look at putting down a small price for my health and my back to keep me going, I'm 47 years young, I have a lot of living to do, and I did not want to have to deal with a walker or a cane or the pain meds or things like that. This therapy has allowed me to move away from those worries and those fears and be able to move on with my life at 47 years young and be able to live it quite normally without the pain in a fully functional job, without having to go into the office, into a desk job. So now that I've completed this program, I have 6 kids. I have 11 grandchildren. We just got done successfully opening the pool together, which was going to be a challenge for me as well to get that big cover off the pool. The kids and I are now I'm able to jump on the trampoline with my grandkids, which I could not do before because of my back. I have been remodeling the whole upstairs of my house. I've built cupboard doors for my cupboards and redone the counters, the walls, the trim. I've done it all. It has taken me probably a year and a half now to do my kitchen. And in the last 2 months, I have completely finished it because I don't have the rest periods anymore from building the cupboards or standing or this or that. So I've been very successful at speeding up on finishing the projects that I have going at home as well. It's been very wonderful for my back, my life, my mood. I was very cranky before, and now since day 2, I've been free from a lot of the pain, and my moods have been astronomically good.
So Todd, we don't want patients to struggle. We do have a great special. If they call our office today, or they can go online for $65. We'll do a consultation. We'll meet one-on-one and discuss what's going on, but also to do a physical examination of the spine so we can get answers to what's causing their problems. It's a great offer for them, and we do participate with many insurances. I do want them also to know that health savings accounts and flex spending accounts are also welcome in our office.